Hi everyone! In today's video, I want to talk about another question that I get asked by parents all the time. So at some point during some checkup, inevitably a parent will ask me, do you think my child will need braces someday? And it's a great question. And usually it comes up because maybe that parent had an experience with years of braces when they were a teenager, or it's something that they're worried about based on something that they're seeing. And I love when this topic comes up early on while the child is still young, because when we think about this topic, in the preschool years, we just still have so much of the child's natural growth and development to work with, to really come up with a strong, solid plan and see if we can minimize their chance of needing years and years of braces later on in adolescence. So just a quick introduction. My name is Dr. Bana Ball. I am a board-certified pediatric dentist and the founder of Shady Pediatric Dentistry in Rockville. And I'm doing a series of educational videos on topics relating to oral and dental health. And in last week's video, the focus was on different causes of bad breath. And towards the end, I was talking about mouth breathing and its relevance, and also how harmful it is, and I said it deserves a video all on its own, which I thought I would do this week, but I'm pushing that to next week to kind of coincide with its Global Airway Health Day on October 2nd, which is next week. So October 2nd, O2, oxygen. So we will push that back, and the things we'll talk about today actually will tie in pretty nicely with next week's topic. Mouth breathing, airway, crowded, crooked teeth, relationship problems with the upper to lower jaw. It all actually goes hand in hand. But today I'll review some different causes for why your child may require some early interceptive orthodontic or orthopedic care. So you might be really surprised to find out that a pediatric dentist actually can identify at a very young age, so as early as maybe 2 or 3, what the future holds when it comes to orthodontics, because even though our children grow, of course, and they grow a lot, and their baby teeth are replaced by permanent teeth, the thing that doesn't change very much is the shape of the jaws and the relationship of the upper to lower jaw. And that relationship is super important. So they have to match up. The same way that it would be problematic if our legs didn't match up in terms of their length, and if they're uneven, I mean, yes, you can still walk around. You would be kind of hobbling or limping, and you could actually live like that the whole rest of your life. And but the same is true for the jaws. They really need to match up for optimum chewing, speech, and airway health as well. So I'll kind of break today's video up into 5 overarching themes, and the first one that I'll talk about is something called a crossbite. It's something we see pretty commonly, and we can see it in the back, so in the molars. We can see it in the front. We could also sometimes see it both back and front in more extreme cases. But the way to think about the relationship of the jaws is they need to match up in 2 different dimensions, basically. So front to back, they need to be aligned with each other properly, and then also side to side, left to right. So in a crossbite, what we have, in a posterior crossbite, so affecting the back teeth, what we have is, instead of, here's my handy dandy tooth model again, instead of the teeth matching up the way they should, which would be that the upper teeth are farther out than the lower teeth, kind of like you see here, we have the reverse. We have the upper teeth inside the lowers. The underlying cause usually is an upper jaw that is too narrow, so a narrow palate. And there are a lot of developmental reasons that play into this, and but for just sort of simplicity's sake, we'll stick with sort of what you can do about it once it's been identified. So the good news is a posterior crossbite is very easy to treat. There are all kinds of different appliances, and every provider has their own preference as to what they like to use. But within the matter of months, you can get widening of that upper jaw, and you can get the proper alignment and eliminate the crossbite. And it's really helpful and important to do that no later than about ages, maybe 7 or 8. In some children, it can be done earlier, but the longer you wait, the harder it is to do, because the bone is not going to be as soft and spongy, and also you're going to get fusion of, there's something in the middle of our palate, there's a suture essentially similar to in a baby's skull, and that hardens up, and then you no longer have that flexibility. So if it's a crossbite in the front, kind of same idea, you have sort of like this, or I'll demonstrate. It would be like this, and that is a little bit tougher to treat. So, but again, important to see an orthodontist and get some help around age 7. There may or may not be major interventions that are going to be recommended right away, but just monitoring that growth and development and trying to modify it by sometimes holding the lower jaw back a little bit and enhancing and promoting more growth of the upper jaw. That's kind of one of the main strategies. So those are basically our crossbites. And let's talk about an open bite. An open bite I can't even really demonstrate. I will just have to explain, because basically what it means is the back teeth are touching fully when you're closed, but in the front, the teeth are not touching. They're not coming together. Most of the time we see that, especially if we see it in younger kids, from thumb sucking or finger sucking or prolonged pacifier use. So the best thing you can do is to try to get rid of a pacifier as early as possible. So, and I don't mean to upset anyone or stress anyone out, but way before age 3. Really by age 1 is when you want to kind of be done with the pacifier, because the longer a child has this thing basically blocking the upper and lower teeth from coming together, the more it's going to actually affect the entire shape of the upper jaw, narrow it, pinch it, cause the upper teeth to kind of come forward and be flared. And the longer it's like that, the less likely it is there will be any kind of natural self-correction, even once the pacifier is finally eliminated. And I actually wrote a blog article that is available on our website that goes into great detail about why and how to eliminate the pacifier by age 1. So moving on to something called overbite and overjet. I feel like overbite, that term, most people are familiar with it, but there's a little bit of a misunderstanding. So the technical, people think that means, buck teeth, or that, the upper teeth are kind of way protruded. Technically this, and the dental world, is called overjet. And an overbite is if you have such deep overlap of the upper teeth to the lowers that you don't even see the lower teeth. And then in extreme cases, you even have the lower teeth kind of pushing into the gum tissue of the palate. We call that palatal impingement. And I mean, it can really cause some harm and damage to that tissue up there. And so children who have that tend to feel pretty uncomfortable and have these chronic ulcers or sores up in the roof of their mouth from how the teeth are kind of jamming into that. So both of those things too, again, trying to treat them early or even prevent some of those things from happening. The sooner we can intervene sometimes as we're seeing certain problems develop, the better the chance that the problems will either be completely eliminated by the time the permanent teeth grow in, or at least minimized in terms of their severity. And there are ways that we can guide growth and development. So there are appliance systems that are specifically designed, for children to harness their natural growth and development. One in particular is called Healthy Start, which is also focused on developing proper airways and building the right muscular tone, proper tongue placement. All these things are such huge components in how the teeth ultimately grow in. So if the teeth are really crowded and crooked, it's not because the teeth are too big. That's really never the problem. There's hardly ever such a scenario where you say the teeth are too big. It's not really a thing. It's that the jaws are too small, that they're underdeveloped. And so guiding proper growth and development early on is, I can't overstate the importance of that. And so of course you would need to, see a pediatric dentist who is well versed in this topic and who can really help you identify if your child is on that path and help guide you and give you options for what you can do, and then also work with orthodontists and get them on board at the right time so that your child can have a healthy, beautiful smile, and a good airway and nasal breathing, and just reach their fullest potential when it comes to how they can look and feel. So that was sort of the tie-in to mouth breathing, which again we'll get into more next time. But maybe the final note that I want to make is, if you have a young child who still has all baby teeth and you notice that all of their teeth are touching, and you don't have gaps in between, you don't have spaces, that's a sure sign that there's going to be pretty substantial crowding in their permanent teeth. So, when you see that, just know that you might want to get a game plan in place for how to help them grow their jaws a little bit more effectively, and not have to deal with potentially years and years and years of braces in adolescence, which will ultimately not lead to the same type of stable long-term outcome that you could get by allowing the teeth to grow in less crowded, less crooked, and in the correct positions in the first place. If you're an adult and you've had braces, you know that unless you have a retainer type thing, whether it's a fixed one where it's a metal bar behind your teeth or some type of Invisalign looking retainer, if you don't do that, chances are you have had or will have some kind of relapse. Because the idea really is to try to get the teeth to grow in, the permanent teeth to grow in correctly while everything is still malleable, right? The bone is soft, the teeth can be redirected with guiding appliances, and you may not have to worry about braces at all, or maybe just something to fine-tune later on. So I hope this video was helpful. If you have questions, please reach out to us. Sometimes more information leads to more questions, so we are happy to talk to you about the specific needs of your child or children. And thank you for watching, and take care.